Hi, welcome to Navajo County Connection. I'm Dawnafe Whitesinger, District 5 County Supervisor, and today we're talking a little bit about schools. I know that it's the month of August and most of us have our kids sent back to school and teachers are back in school, and it's an exciting time of year.
It sure is.
But we have a special guest today with us, our County Superintendent, Jaylyn. Jaylyn, why don't you spend some time introducing yourself and telling a little bit about your history.
Thank you for having me. I have been in Arizona, Navajo County, particularly for 29 years now. I've worked through supervised preschool systems and have worked through post-secondary, so have seen a little bit of it all. And was taught 6th graders, did some computer labs, so seen gifted, just been involved in a lot of different aspects of education. So now I'm in this role, and it's kind of exciting. So,
and when you say this role, I think most of us are wondering, what does the county superintendent do? What are your responsibilities?
We are the fiscal agent for the districts that we supervise through ADE. So it's the districts under the Arizona State piece, and not charter schools and not private schools. Mm-hmm. So that's one piece that most people do not understand. All the payroll goes through our office. That's a big piece. We help work with districts as far as their grants and those pieces. Another component is to look at professional development. Our office is an integral part in developing teachers. We just recently signed a memorandum of understanding with NPC and NAU to help develop our teachers in the area to get them in the classroom. So take them through their coursework so they become successful teachers in the classroom. Another big piece is we supervise and provide the education for the Hope School, the Juvenile Detention Center. My office also runs what's called the Special Services Consortium. We help provide special services to districts in Navajo and Apache counties, and we include a lot of the Bureau of Education schools in those, and help districts be able to provide services that they couldn't do on their own. Mm-hmm. That's a big component of it, and I'm probably forgetting something else, but that's okay.
Yeah, it sounds
we have
like
a lot of hats.
A lot of hats and a lot of responsibilities that your office overlooks. Mm-hmm. And so when we were talking a little bit about this before, you talked about helping community members receive credentialing for teachers. Mm-hmm. And certainly we have seen teacher shortage, the impact to our community, and certainly something that's very useful. So grateful to hear about the partnership with NAU. And NPC has done such a great job in helping our community members prepare for that transition, because I know that they have a program that supports community members, and so that they can easily transition to a 4-year university if they're interested in pursuing their education. Yes. So grateful to hear of that partnership.
Thank you.
Well, one of the other things is just school buildings in general. What does that look like when a school administrator is preparing for school?
It starts about the second day after school's out. They start preparing those class lists, looking at their staffing needs, looking at what their building needs as far as repair and taking care of it. A school administrator on site is very, very busy with a lot of activities. It is not a downtime for them. They're involved in all that other work. A lot of times there's summer schools going on, so also working with those programs. One of the other programs we'd like to get involved in is what's called Kinder Camp, and that's a United Way project, but it's also looking at getting students who are entering kindergarten in the fall, working with them in the summer. Right now it's fairly limited. I would love to see that rolled out to other districts, but school administrators overall are looking at what can they do so when teachers come back that they're ready and they're prepared, and setting those budgets up, everything they can do, they have things ready to go.
It certainly is challenging. One of the other hats that I wear is I work for Dischipico Community School out in Sibicu. And that preparation certainly, starts in the springtime in preparing for the next school year. And some of the challenges are maybe looking at the student population and how many students are coming and going, professional development needs, certainly staffing, you know, it's a gamut of things. So I know at the beginning of the year, those stresses don't go away, that you're continuing to look at, well, how can I help my school progress? And grateful to hear about the Kinder Boot Camp. I know that our school system we have a Kinder Boot Camp as well in the past, and have seen great strides with our little people who come in and start kindergarten and ready to go. Yeah. I always say, as a school administrator, my two favorite times of year are the first day of school, and seeing the kindergarten students come in, and they're so excited, and the infinite possibilities that, you know, those little kids have. And, you know, and moms do I'm guessing it's moms, there might be some dads out there that do such a beautiful job in their little girls' hairs. You know, all these braids and but that's a side note. When we talk about parents, how do parents help our students transition?
Looking at getting ready for school, and once school has started, what can you do? The biggest thing is set routines. And I actually had to make a list because there's so many things you can start thinking about. Students, when they come home from school, probably haven't had lunch for quite a while ahead, so they're usually really hungry. So knowing that ahead of time, having something ready for them to eat, and hopefully it's not the chips and soda routine. It's been a while since they've been up and moving around, so letting them have a chance just to move. Unfortunately, the way schools are anymore, those kids are sitting in chairs for 6 hours a day. We know that sitting is not healthy for children, so letting them have a chance to just run, ride a bike, play outside, do something active. They need that activity. We know that those students who are engaged actively and physically, their brain development and all that they're learning engages more. We know that's just sound, and they need a break. And then setting that routine. When are you going to do your homework? Are you going to do it before dinner or after dinner? Are you going to look at giving them some choices of when they do their homework? It's not if they do their homework, it's a matter of when they do their homework. And so once they have children have feel they have a choice, then they tend to the power struggles tend to dissipate a little bit better. So knowing that, and if you see that your child is having a hard time with that homework, talk with their teacher right away. Don't wait till the parent-teacher conference. Talk with them about any things that are unique and special about your child. One of my own children, growing up as a young child, they would have a head cold or allergies, and they would get fluid buildup in the ears. So their hearing wasn't as good so if the teacher was giving directions behind them, they wouldn't act out, but they didn't know what they were supposed to be doing. So just knowing that those unique features of the children, and so they know ahead of time how to handle those unique pieces, then, okay, I need to make sure I'm in front of the class and all the kids are seeing me. It's cold season. That if it's happening with one child, it's probably happening with another child. And making sure you establish those routines early on and giving kids some choice. So the other thing is, when they get home from school, the notorious question was, how was your day? And most children will say, it was fine, it was okay. So change the question. So what did you do in reading today? What's your favorite book that you read today? What did you do in math? Did you have PE? Who did you play with at recess? And then they're going to have a conversation with you. So you have to change the question up if you want a good answer for your child. So knowing that ahead of time helps develop that conversation about school.
So it sounds like ultimately knowing your children. You know, I think of my own sons and the transition process. Sometimes it goes great and sometimes it doesn't, and paying attention to those cues. And maybe, you know, more sleep. I think all of us know what that looks like. You know, we've had late night with our kids and playing games and eating ice cream, and don't have the luxury of doing that anymore. And I think those things are fun and great, and, you know, and helping to keep a positive vibe in the house on supporting our kids in the education system, I guess. And sometimes, as you said, it might not be going as well as you hope it is going. And so paying attention to those cues, and maybe talking to teachers administrators, principals, whomever you feel comfortable in talking to and helping the transition process. So
It's real important.
yeah,
It's real important.
it's very important. What should we do as parents to help ourselves through the transition?
Well, and our own routines have to change. And knowing that, okay, I have to set aside some time to listen and have that conversation. Are we having dinners together? Are we having those meals together? You know, spending those 10, 15 minutes, 20 minutes, whatever, and dedicating that time. We all have rushed lives, but knowing that this is their time is really important. And they're only a child once. You only get one shot at this, so don't think, oh, I'll do it tomorrow. Well, tomorrow happens pretty fast. And I see young mothers anymore, and I'm like, you don't understand how fast this happens. They go into kindergarten, and it's like, whoosh, before you know, it's really eclipsing quite quickly. So take the time, enjoy the time, enjoy every moment that you can with them. Yeah, it's important.
I think that's very true. You know, people have always said that. You have children, it'll go in a blink of an eye, and it does.
It does.
And I think, when I think about schools, the partnerships that are so important, not, you know, and not waiting for the school to reach out to parents, but maybe the parents reaching out to schools, or how do you become a better support system, maybe more active in school roles. All of those things are supportive in helping our children thrive and be successful.
Absolutely.
So, yeah. And some of the questions I didn't ask and didn't think to ask are about Navajo County itself and how it's set up. What does that look like when we look at our schools across the county? How many districts, how many schools, how many children?
Yeah, well, I don't have the child count. It's pretty high. Under our office, we work with 11 K-12 districts and 2 what are called JTEG districts. They're the Joint Technical Education Districts with the CTE programs, the Career Technical Education Programs. We work with those. And then with our professional development, we've opened that door to anyone, homeschool parents, anyone, that charter school, private schools, it doesn't matter. If you're working with children, we want you to be welcome at that door for our professional development. And we have that rolled out now on our website. We finally have a Facebook page. Yay! We're excited.
So like us.
Yeah, so like us, exactly. If you want to know what's going on with that. We highly encourage, it's that time of year, if you're a homeschool parent, that you register your child in our office and make sure you bring an original birth certificate is the main thing that a lot of people sometimes forget, but we will accept those, and we do that in the Sholo office and in Holbrook. So about 40 schools altogether, plus or minus, is under our purview, and so part of our office job is with pay is to make sure the credentials are on track. So every pay period, they're going through the credentials and checking those. If you can imagine that, how tedious that would be to look at credentials every time people are being paid, to make sure, you know, those folks in the classrooms are fully credentialed and ready to go. And then working with districts if anything should happen. So that's a big piece of that.
Great. Well, I'm so glad you could join us today. Are there any other things that you would like our community to know? If they have questions, what should they do?
Sure. Well, right now it is an election year. We have governing board seats open and available. I know the deadline's August 10th, which is right now, pretty much. But the issue is I want people to vote. Please, you know, exercise your one right that you have in this country. And we have a lot of people registered to vote. They just don't do it. And so I would highly encourage everyone to vote and get that piece out there.
I agree. I agree. And thank you so much for joining us.
Thank you.
We're going to take a short break, and when we come back, we're going to visit with the Navajo County Health District and talk a little bit about immunization. Welcome back to Navajo County Connection. I'm joined by Ashley Thackrah from the Navajo County Public Health Services District. And today we're going to talk a little bit about immunization records and immunization shots. And I'm going to give you the opportunity to introduce yourself, a little bit about your background and maybe how long you've been in the community and what it is you do for our community.
Yeah, well, I've been a nurse for about 6 years. I used to go to the public health department for some of my immunization services, so that I always had a really good experience, and when I saw that there was a job opening at our public health department, I wanted to apply and I joined. But yeah, I work in the nursing department in our Sholo office mainly.
Great. Well, welcome. We're glad to have you. This month is a special month, not only that we have children going back to school, but it's Immunization Awareness Month. And when we talk about kids going back to school, you know, we're familiar with keeping our kids' records up to date, and why that's so important. And I know that with immunization shots, there's been a little bit of controversy behind how we keep our students or our children updated on their shots, and what does that look like. So can you tell us a little bit about that?
Yeah, well, I mean, in the public health department, public health officials think of the community as a whole and how we can keep each other safe. That's really our main goal. So we can kind of look at it from the perspective of why should we get immunized? What things should we think about? So there's a few main points. One of them is that serious diseases still exist. There may not be as many serious diseases in our country, but that's really because of our use of immunizations. The less people that get immunized, the greater the chance there is for an outbreak. So that's something to keep in mind. And we've even seen real life examples of this with the Disneyland measles outbreak. And even in one of our other counties recently, we've had another measles outbreak. There's also a global risk that we can think about for families, adults and kids. Lots of people like to travel internationally. There's diseases in other countries that we don't have here, so that's something to think about. Polio is an example. Another thing to think about is this concept of what we call herd immunity, and that is if we get vaccinated, we're not going to get a disease and spread it to others. So if we think about that in the big picture, how many people we can get protected from diseases, then we're not going to give it to people. So that's a big deal for our vulnerable populations, people that truly can't get immunized for one reason or another. That might be an age restriction, or people who have serious health conditions. A child that's being treated for cancer would be an example of that.
And so being a parent and thinking about our children and keeping their records up to date, how often should a parent be checking to ensure that their records are up to date or children have the right shots?
Yeah, well, I mean, it's best to think before they're going to start like a new grade. We have kids that usually parents are reminded right before the school year comes, and that's totally fine. As long as you are just trying to keep that record with you as long as you can up until they're 18. Sometimes it doesn't work out and it gets lost, so we'll just do our best. But if you can keep that record as long as possible and just check it maybe every school year even, you're not necessarily going to need shots every school year, but just checking it. And if you have any questions, you can always call your doctor or the public health department. We can help figure out like what a child is due for and what's appropriate for them.
Great. I think, well, another, perspective is not only children, but what types of services are there for adults and what should adults be paying attention to?
Yeah, well, there are definitely vaccines for adults. Sometimes we forget about that population once we're not kids anymore. But this would be especially important, say, if you're traveling out of the country again. If you're not caught up on your childhood immunizations, sometimes that slips by. And if you're pregnant, or if you're around kids a lot. So that goes back to the same idea that if we're protected, we're not going to give it to other people who are more vulnerable, like little kids. So, yeah.
And if I were an adult and I wanted to go over to the Public Health Services District, what types of services would be offered?
Yeah, so in regards to nursing services, so we have the immunization department again. I'd like to mention too that we have 2 programs for adults and kids for vaccines, that if you don't have insurance or your insurance doesn't cover vaccines, you can qualify for free vaccines, so that's a really nice service. We also do disease investigation for communicable diseases, vaccine preventable diseases, STDs, tuberculosis, to name a few. We have STD testing. We actually treat for a couple of them too. We have family planning services, which offers annual exams for women, and we also offer birth control to women too. So those are the main things for nursing services.
Okay. And most of your nursing services are geared towards adults, or the ones that you had mentioned. Which ones are specific to children, or do you offer programs for children?
I would say the one specific to children would be the vaccines. So any of the childhood immunizations, we've got most of the vaccines that are available today at our department. So yeah, that's the main one for kids.
And we talked a little bit before the taping and about immunization records, bringing those with you if you have them available, and if not, what do you do?
Well, fortunately, in Arizona, we have a state registry system where a provider can go and enter a person into this registry system, and we can keep track of immunizations that have been given. So as long as providers from various places have been entering that information in, we should be able to pull them up online and see what they've had. It's nice if they bring in a personal record, and then we can kind of compare the two and make sure they're both matching up. If not, we can still work with that totally. If there's absolutely nothing available, we can kind of go by what's needed. Sometimes we start over again. Sometimes we can kind of figure out more like what's most important at that time.
Okay. I'm thinking from my own, I'm sitting here thinking, when was the last time I received a shot? And should I have received a shot within the last 10 years? And one that I can think of is like a tetanus shot.
Yeah.
Recently I was in I skid my leg and I went to go get stitches, and they asked me if I had a tetanus shot, and I couldn't remember if I did. So if we don't remember or we don't have our records, could we come to you and utilize that service to see if what our history looks like?
Yeah, for sure. If you're not sure of your immunizations, it's always better to err on the side of caution and immunize again. It's not going to hurt you, so some people have that concern. The only thing that I can really do is raise your immunity levels a little more, boost it a little more. So, if you're not sure, we should err on the side of caution and go ahead and immunize again. So,
great. Well, are there any other things that we should be, that the public should know about? The types of services that you offer, or outreach, or how do they get in touch with you?
Yeah, there are a few community events that we sometimes participate in, so you can find us that way. I know we had some nurses in Heber this past weekend. We have the Facebook page again that was mentioned before. Probably the easiest thing to do would be just to call our main Sholo office and speak with somebody there, because then we can kind of direct you towards which program would benefit you for your circumstances, and see if there's any programs that you would qualify for. So always feel free to call. Yeah.
And the public health district, very beautiful building, great services, lots of great people who are very helpful. I think it's such a quality service for our community members, and maybe something that you're not aware of that exists. Even the immunization shots and their availability, being able to go down to the local county health office and being able to look at your records and maybe get some of those shots that you need to be updated, not only for yourself but for your children. And utilizing your insurance, or if you're not able to, or you don't have insurance, and you're helpful in providing the resources to ensure that everyone has the services but can also pay for those services. So, thank you so much.
Thanks for having me.
Thank you, Ashley, for joining us today. We look forward to seeing you on the next Navajo County Connection, and have a great month, and make sure you're checking your records and paying attention to your immunization.